Hi, this is Princess Osita Oleribe. I'll be presenting to us the social determinants of health, SDOH in short. Learning objectives for today is to understand what health is, what social determinant of health is, what the different categories of SDOH are, and to be able to classify the factors that make individuals vulnerable, individuals or group really, and then to justify the role of policy in addressing health equity. These learning outcomes are tied to your learning outcomes in your syllables. Now, social determinants of health matters. The reason why it matters is that it affects a huge portion of the health outcome we see. A lot of times people think about how fancy the hospitals are, or how educated their clinicians are, or how record breaking the equipment are. But ever before anyone gets to the hospital, there's so many other factors that play into what their health outcomes are. Now, some of these things are important to note. If you take out healthcare in this diagram by University of Wisconsin, you're going to find that there are 80% other factors that contribute to people's health outcome ever before they get to the hospital. And what is health? You're looking at a state of complete physical, mental, social well-being of individuals. It's not just the absence of infirmities or diseases. It is how well these people are in other aspects of their lives. And so understanding that these social ecological factors lead to a huge percentage of their outcomes, much more than any healthcare institution can offer anybody. Now, what is social determinants of health? Now, CDC defines this as a condition in the places where people live, learn, and work. These conditions affect their health risk, it affects their health access, and it affects their outcomes. Now, poverty can, for instance, limit your access to healthy food and your ability to pay for rent in a healthy environment, and so also your ability to go to a good school or to have opportunities for a good job. So there are so many ways that indirectly issues in our lives affect our health. There are these 6 categories that the Kaiser Permanente uses for categorization of social determinants of health. You probably have seen the other diagram where there are 5 categories. In that one, everything here is there except for food. But the important thing to note is all of these factors, whether you're seeing 5 categories or 6 categories, embody almost everything that we talk about when we are looking at the issues that affect people's health access and health outcome. So under economic stability, you're looking at employment, the income, the expenses, people have their debt, their medical bills and support. Now, someone may have debt that affects the ability to sleep at night, and you might think it's just the person just had debt, but that debt is raising their blood pressure and is affecting their quality of sleep and is affecting so many other aspects of their life. And we can go the same route in looking at these different components of the different categories that we see here. So neighborhood and physical environment, you're looking at housing, transportation, safety, parks, playgrounds, walkability, zip code, and geography. In education, you're looking at literacy, language, early childhood education and training. It's very important in how people end up eventually in their lives. I have told this story very often about a situation in Nigeria where a lot of infants were found with permanent blindness, and the reason for that is that their mothers who were not able to read picked up tubes that looked like eye drops and applied it on their kids, not knowing that they were ointments, and the ointments contained substances that had the effect of blindness on their kids. Now, a more educated mother wouldn't do that to the kids. And let's not talk about the ethical issues around making such tubes available in a community where people could not easily read and write, at least not in the language that the drug had. Education has a huge impact in people's health-seeking behavior. It has an influence in people's coping mechanisms with infirmities or diseases, or even their coping mechanism with mental and social issues. Now, food access is a very important subject that we can dive into and dwell so much around. I once lived in a small town in Oregon, and even a smaller town than the one I lived in, you would go miles without finding a healthy store. All you had is convenience store. So if you didn't even have a vehicle in that place, you couldn't go to a healthy store. So you're left with canned food and not the best healthy meals possible. Social integrations, support systems, community engagement, these are so many issues that play a lot of roles in affecting how people turn out ever before they reach the hospitals. So when you're looking at health outcomes, you're looking at issues of mortality, morbidity, life expectancy, healthcare expenditure, health status of the people, and even functional limitations, right? Things around disability or some of those complications that could have been avoided if they were addressed at any point in these different categories. Now, I did this assessment when I lived in Oregon, and you're welcome to go to this website and put in your own address and see what it tells you about life expectancy in where people live. Now, the saying goes that where people live can really affect how long they live. In the state of Louisiana, for instance, you have as much as a difference of 25.8 years in how long people live, depending on where they live. And so this is the assessment I was saying I did. I put in my zip code to see where people fared in my small town. In my small town, we had a small life expectancy of 76, whereas the state had 79. Now, you guys, in your county, you're dealing with almost the same 1 year difference in life expectancy for the state. Sometimes it's as huge as 25, as I mentioned. In Chicago, you have a difference of 30 years between different zip codes. And these are avoidable and unnecessary differences in health risk and health outcomes that people face. And that's why we talk about social determinants of health, because we know that these things can be corrected. We know they can be addressed if the right measures are put in place. Now, what are the things that make people vulnerable? It sometimes is their demographic characteristics, right? It's how people look, it's how people sound. It is in the social structures a lot of times that are even a function of their demographics, or is health belief. Sometimes it's religious or it's cultural, all kinds of things. I've done a project in a rural community where our work was essentially to educate mothers on how to handle childhood diarrhea for their children, and it made a difference in terms of how long their children lived or if they died as infants, and it matters in so many different ways. Anyway, health risk could look like different factors, right? Resources available to assess the care. It looks like acceptability of the health programs that are available in that place, and it could be chronic diseases that people are faced with, or the cost of outcome of health care. So many different things, right? So what is vulnerability? You've heard me use the term very often in this lesson. We are looking at risk. So how much risk is someone faced with, right? When you bring these risks together, the convergence of them is that vulnerability that we're talking about. In terms of health, going back to the definition of health, you could look at the vulnerabilities in terms of the physical vulnerability, in terms of mental and social vulnerability. And a lot of times when we talk about equity, people think only about race, but it's not just about race, it's also about gender, right? It's about sexuality, it's about age, it's about physical ability, it is about class and income. It's so many different things in different scenarios. Now these things converge to increase the risk that people have to deal with in their effort to arrive at a healthy outcome for themselves and their populations. Vulnerable people just goes along the lines of what I've been talking about, the racial and ethnic minorities, uninsured people, right? People even without the right immigration status could pass on free health access and free health services because they fear that it could be a bait to get them arrested and all those kind of things. Socioeconomic factors playing, because really even when you have the insurance, you have the co-pays and all of those limiting factors in the way of people's access. Now, vulnerable people look like different things. They look like people who are elderly, people who are chronically ill, mentally ill. Looks like women and children. It looks like people who are disabled, people who are homeless, people who have different kinds of chronic diseases. Here I have HIV, but it could be diabetes, it could be cancer, it could be different things. Now this man is someone referred to as the father of SDOH. He said something really striking. He said, if you're smart and poor, it is not enough. Poor will put you down. If you're rich and dumb, hang in there. So what Michael Marmot was saying here is that you can be as smart as you want if you cannot afford to get yourself the kind of care you need, if you cannot get yourself the kind of education you need, if you cannot get yourself the kind of transportation you need, the kind of housing you need, the kind of clothing you need, the kind of food you need, you are in trouble. So just being smart may not be enough to get you out there. And he has a video, he has a lot of videos, but I put one of them in this lesson for you to have a time to interact with him. Now, I talked about being deliberate about intervening in these issues. The place of policy in addressing social determinants of health is so important for us to go with this knowledge we have, knowing who people are, not just as victims of these determinants of health, but also as influencers, as implementers, as people who could make a difference. And looking at the government and authority figures coming into the picture to design programs, right, make decisions, put in place action steps that will promote health and well-being of the people they serve. Public policy takes different forms, right? It could be in terms of education, it could be in terms of housing, it could be in terms of healthcare. It's so many different things in so many different places. But these three components have to be in place: the knowledge, the people, the authority figures. In this case, I'm saying the government is important in generating the policies that are important. Now, one other thing is that the whole point is to reach health equity. In the next lesson, you have heard about health equity and why it is important, reaching the best health outcome possible. It is looking at all of these things that are in existence, the social determinants of health, the health systems we have, and then trying to use policies to help people to attain the health outcome they need. Now, there are many things to be considered in dealing with our health policy, right? It is the political context, it is the social cultural environment. But ultimately, what leaders are looking for is to arrive at solutions using the resources they have, leveraging the stakeholders and making sure that everybody has a part to play in it. What does good health look like? It's important to know that good health looks like eating well, staying active, not smoking. It is having enough sleep. It is receiving routine health care visits, but also it looks like other things. It looks like having resources to meet your basic needs. If, for instance, someone is hungry and you're giving them money to go buy medication, they're not going to buy medication, they're going to feed first of all. If you're giving them money to receive some long-term care and they have not paid their children's school fees, depending on which country you're living in and what struggles you have with that, they may not be able to do those things. So good health looks like quality access to education, to jobs, to healthcare services. It looks like community-based resources, right? Having a place where you can take a walk rather than sit indoors, or where you can feel safe when you're lying down at night to rest. Is like having reliable transportation, that you're not having palpitation every time you have an appointment. Good health looks like different things in different places, and so it does not look like one thing. And so policies that will address these social determinants has to be comprehensive in the way that it goes about helping people attain the best health outcomes possible. Okay, let's look at a case of a woman who shows up in the hospital by the name Susan. This is a publication from one of the medical institutes in the US. So they were talking about this young lady who shows up in the hospital and she has stomach ache and migraine. In the first scenario, when she tells her story, the doctor loads her up with medications and sends her away. But what happens? She returns and then she has much more problems than she had initially. At this time, she's needing abdominal ultrasound to be able to know what else she needs. But this scenario could be reversed, where this lady shows up in the hospital, tells of her stories, but the healthcare worker digs in deeper to find out what is her situation, because her situation may not look like the health situation that you have in front of you. It has so many different components. And so looking at this woman and meeting her where she is at is what you do in health equity and social determinants of health interventions. And so this woman ends up a better person, a better contributor to the society than the same woman in a different response, as we saw in the previous slide. Now, I want us to see this slide, one quick thing before we end this presentation, that what health equity and health policies should do. Now, when we say targeting vulnerable populations, it is not just because of the vulnerable population, it's because of all of us. We are not safe if one of us is not, right? It affects the generality of the population health of our community. So when we meet those needs, we look better for it. But it's not just in looking better in that kind of superficial way, but it is in the resources that are saved when you intervene early. It is in the reduction of the risk that the healthy ones or the rich ones or the comfortable ones face when other people are at risk. It is also in providing opportunities for people to contribute to the economy of the society. When they are healthy, they're able to contribute, they're able to serve the society better, they're able to take care of their own selves and their immediate communities. Vulnerability and equity cannot coexist. If we want to be a society that is interested in equity, we must take care of the vulnerable populations in our midst. Now, I want us to have this quote in mind as we live. It's from Healthy People, that by working to establish policies that positively influence social and economic conditions and those that support changes in individual behavior, we can improve health for large numbers of people in ways that can be sustained over time, improving the conditions in which we live, learn, work, and play, and the quality of our relationships will create a healthier population, society, and workforce. So when we work on social determinants of health, when we work on health equity issues, we're doing it for all of us. In closing, I want us to take the time to look at these very, very interesting videos that go to the point of social determinants of health and how and why they matter. Thank you very much. If you have any questions, feel free to raise it with your teacher, and I'll be happy to answer as much as possible. Thank you. Bye.